is David Lloyd, and I'm the founder of MTM Services, and our subject for today's 2-hour webinar is skills needed to move from a supervisor role to a manager role to a leader, and a visionary leader at that, by the way. And this is a quote out of my last book on leadership skills to support high-functioning teams. The need for leaders to continuously step across the threshold of risk, and I'm going to define that threshold of risk today, to make bold and creative decisions that transform service delivery processes and methods. That's really what we're talking about today, is how do we become, again, bold in making decisions and step across this risk threshold that seems to really hang a lot of supervisor managers up, meaning I can't do that because. So we're gonna focus on that today. Thank you so much for coming. We have over 500 registered attendees today, and so I look forward to our next 2 hours. There will be question and answer at the end of the session, and at that time I'll ask you if you have a question to raise your hand on the panel on the right, and I'll move to as many as I can based on time available. The MTM team, and you can see that represented here, where it really has differences, and 6 of us are going to participate in what we call Follow the Leaders. It's a summer webinar series, and it's free, and it's available to anyone who would like to come. The first one, as you can see today, is obviously the one that you're attending today, but our next one is Dr. Valerie Westhead, and she'll be talking about breaking down silos and building teams from the clinical perspective and the medical team perspective, and you can see that's July 11th. This particular page is on the mtmservices.org website, and I put the website address up here at the top. If you would like to go to that, you will see a scroll across the top of the website. It says Follow the Leaders Summer Webinar Series. Just click on that and you'll go to this page, and you can see the different team members. Michael Floor will be participating and presenting in July on coaching staff. David Swan will be talking about making every leadership moment matter in August. And Annie Jensen will be talking about using data to drive culture and client outcomes, and that will be in August as well. And then Scott Lloyd, president of MTM, will talk about indecision has a cost on the workforce and the cost of care. So he'll be presenting that in September. And as you can see, you can register for any of those or all of those. They also will all be recorded, and after the session, then you'll be notified of how to download the recording and a PDF copy of the slides for each of these webinars. We hope that this Leadership Summer Series will be helpful to you. Please invite other members of your staff if you feel they can benefit from it. And again, we're glad you're here today. A little bit of background on myself. I'm founder of MTM Services. I founded the company in 1995. After having worked as a deputy director of a behavioral health center here in North Carolina, and I'd also been a board member of that center prior to becoming a staff member. My background is 25 years in the for-profit world, in the, if you will, corporate world. I was CEO of a multinational corporation. We operated across the United States and in 5 foreign countries. And I was with that company for 25 years and retired. Prior to my retiring, I was appointed by the county commissioners to a behavioral health center board here in North Carolina, and I started to really fall in love with what we do and how we could help people. But I also saw a lot of areas where I thought we could improve. So over time, as a board member and then as a staff member, I developed a model called the Accountable Care Delivery System. And so my books, the first one I wrote in 1997 was How to Maximize Service Capacity. I then wrote How to Deliver Accountable Care. That book is still available on the National Council bookstore. And then my last book I wrote by myself is Leadership Skills to Support High-Functioning Teams. Leadership Skills is a book that I published in 2015. It will be a primary focus today of our work. And then I co-authored Operationalizing Healthcare Reform. I have provided training and consultation to over 800 community behavioral health care centers in the United States, and I've focused on service delivery process models, principles, and solutions, as well as leadership training has just been a love of mine. Yeah, my contact information is here. I will use several documents, or if you will, forms. I'll be glad to give those to you at no charge. You just need to email me and say, hey, I'd like this one or that one. Again, I think I will be presenting 3 different tools today that are in the book, but also that are available freestanding. And our website address is there, but you can get the contact information down. I'll show you at the end as well. Here's the Leadership Skills book. It is, again, the basis of what I'll talk about today. The book I wrote was really about a 52-year career, 25 years in the for-profit world, and then 26, 27 years in the nonprofit behavioral health world, and what I learned in that process, and also the work I did to develop tools to help move from supervisory roles to manager roles to leadership roles. And again, the website there is if you would like to look at that book. I guess historically, if you look at our world in behavioral health, historically we had certain challenges that kind of were there. When I became a deputy director in 1993 of a behavioral health center, we had recruitment and HR issues. We had staff performance concerns, behaviors, aptitude and attitude. We had basically staff training. We constantly were trying to improve our training. We had challenges with timely and accurate documentation submission. I hope that you don't have that at your center, but it typically is a challenge. You know, how do we get it in and how do we get it timely? And trying to help our staff get past that overwhelmed feeling of all the documentation I have to do. We had internal customer service challenges. I don't know about you, but between our programs and departments, we had clinical teams upset with clerical teams. We had one clinical team upset with another clinical team. Again, we had medical teams upset with our clinical team and our case management team. We had all of those dynamics going on a pretty well daily basis. Again, I'm not sure if you can identify with that, but if you can, I think it's helpful. Need to renew our state and county contracts. You know, we need to get that done, and that was more of an administrative financial task, but make sure we get our contracts. And we had to send timely claims and reports to Medicaid and other funders, or to the ACOs or MCOs, more modern today. But those were typically the challenges we faced. And all of those challenges created what I call system noise. Now, system noise is defined is the same challenge happening over and over and over again without resolving it. And that internal system noise can get so loud. You know, I would walk into the center in the morning and here came the noise. You know, so-and-so is upset with this. And it was basically a very high emotional level. A lot of energy was consumed with the internal staff issues. This clinical team doesn't like the way that the documentation team is doing, or the medical records team is doing this. It was constant. It was like a never-ending noise. And that historical focus on the internal system need was more workable when our external healthcare environment was not changing at such a rapid pace. Now, today, as we know, our external world is changing very rapidly. And if you just look at the last 5 years, if you look at the last 3 years, if you just look at what's happening in our systems, particularly with COVID and all the different concepts of being telehealth and all the things we had to adapt to very quickly, when those external requirements get more rapid, or change requirements get more rapid, then our internal noise absolutely defeats our ability to respond. Because now, if we look at what we are focused on, and this is just a small list, but you know, we need to have integrated care units. We need to shift to population management. We need to look at volume of services and value-based shared risk or savings funding environments. We need to have access to a clinical assessment the same day the person contacts us. We need to have them to a prescriber within 3 days following the clinical assessment. Now, those standards are being met because we deliver same-day access and what we call just-in-time medical services. So we know that they were being done, and they have been done, but that's a tremendous change. Our client-centered outcomes, are people actually getting better? Can we determine that? And Annie Jensen is going to talk with you about that at a future workshop. Our cost finding, do we really know the cost of our services and treatment? And making a business case, how do we tell a potential funder that we are good, that we can do this? How do we make that happen? And again, those are some of the things that I would say are our primary focus. And if your management team is meeting and you're not focusing on some of these things, it's very important that you take a look at that. When I joined the staff as a deputy director, our management team meetings were focused on internal noise. I need to say that again. Our management team agenda was focused on internal staff issues. Internal staff issues were never ending. And so we didn't have time and energy to focus on the external, as you can see here on slide 8. The values that we have to have today, and these values are critical to us, is we have to be accessible. I've given you the standard of same-day clinical, 3 days to prescriber. Those standards are critically important for CCBHCs particularly. We have to be efficient. We have to provide quality service at the lowest possible cost. We have to be connected with an ability to share core clinical information electronically. We have to be accountable. We have to produce measurement information about the clinical outcomes achieved. Again, we talk about clients getting better, but do we have actual data to demonstrate that? And can we demonstrate that to funders, to consumer groups, to the legislature, or to whomever we need to present it to outside of our own, internal staff? We have to be resilient, have an ability or willingness to use alternative payment arrangements as we go through this whole concept of reform and change. Those are the values. And so I would ask you, as you look at this, what type of focus does your program or your center have on these basic 5 values? Are you focused on those in your management team efforts? Are you focused on those in terms of strategic planning? Those are, again, some questions that might be very helpful. Now, when I went out and assessed over 800 centers, here's what I typically found. I'd like to ask you to see if you can identify with any one of these, because if you can, what we're going to talk about today and throughout our other 5 webinar leadership series this summer can be very helpful to you and to your team. Number 1, I saw most behavioral health centers operating as a loosely held federation of private practices. Now, what do I mean by that? Our child program did things different than our adult program. Our adult substance use program was very different than our adult mental health program. Our medical services operated very differently than our clinical program. Our community-based programs operated very differently than our clinic-based programs. In other words, we all were operating under the name of our center, one umbrella, so to speak, but we operated as if we were totally private practices. I could not, in 1994, I could not shift a support staff from the child program to the adult program because the adult program staff, we had accidents and sickness. I needed a support staff, but I was told that what they did to bring a client in the adult mental health program basically was so different than what we did in the child program that we could not use the same support staff. That's called a federation of private practices. The most ineffective and inefficient method of operating a group practice ever. We had, number 2, lack of timely access to treatment. We had people waiting days, some of them weeks. For our psychiatrists, they were waiting months when I got there. In fact, we did an assessment of how many people were waiting. We had over 425 residents of our county waiting for some level of treatment at our center when I got there in April 1993. We didn't have access. We had a lot of process, but that is not access. We had a lot of paperwork, but that is not access. We had a lot of steps for our clients to jump through, but that is not access to treatment. We had access to assessments. We had access to talk on the phone, but we didn't have access to treatment. Key word here is treatment. Number 3, we had clinically trained managers who sometimes had a therapeutic relationship with their staff. Instead of having a manager, staff, employer relationship, it was more of a therapeutic relationship, which led to low or no accountability to group practice needs. We needed for our clinicians to complete their treatment plans. Well, that was the expectation. Not only was it our expectation as a center, it was the law in our state and in the federal law for Medicaid. We couldn't treat without a treatment plan. But 62% of the adult clients in the center when I got there were being treated without a completed treatment plan. And when I presented that to the clinical director of the adult program, the answer was, Well, everybody's just trying real hard. We're doing the best we can. And the answer is, we're doing the best we can, but what we're doing is illegal. And we're going to get staff and the center in some trouble here. So the point is, so I would say, why is this not happening? Well, Susie or Bill, they had a rough time, broke his toe. I mean, I heard all kinds of issues about why Susie or Bill's staff could not complete their paperwork. But what I didn't hear is how the manager was addressing that and changing that culture of basically low or no accountability. And I think that's a critical piece, and I want you to really think about that one. And that's a kind of an ouch, by the way. That's an ouch one, because typically this is a major challenge in a group practice model. Number 4, inability to measure if the client's really getting better. And again, Annie Jensen's going to talk to you about that in August. Lack of ability, objective business case. Can we actually say that we're doing well and tell people when we can get people in, how timely, what it's going to cost to get them in, what our treatment episode is going to be, and what the cost of that episode is going to be? Those are typically some things that I found were really a challenge for us. Now, I want to talk about the world outside of behavioral health, because so many times when I came from the outside world, for-profit world, corporate world, I was told by the staff in behavioral health centers, and across the years I consulted for 26 years, is that we're different. You don't understand, we're different. And what you learned in for-profit world does not really apply here. So what I did for 26 years with MTM is I tried to bridge the gap between the for-profit world and the nonprofit world. And that's why I wrote the books. That's why I went to 800 different centers. That's why I've tried over those 26 years to bridge that gap, because I truly believe that the challenges we face are basically the same. And I want to kind of demonstrate that. This is from the American Management Association. I've given you the source down at the bottom. You can go to their website, amanet.org. They survey every year all corporate management who are members of the American Management Association, but hundreds of executives from the for-profit world are surveyed. And they ask them to identify the top 6 leadership challenges that they face in the for-profit world. Now I want you to look at these challenges and notice that the percentage at the end is how many of the respondents acknowledge that that was their challenge. But getting people to work together who have different agendas or goals, does that sound familiar to you in the behavioral health world? Does it sound familiar if you're operating as a loosely held federation of private practices? Getting people to work together as a group practice and have group practice standards for access, group practice standards, not program standards, not location standards, group practice standards. Balance competing demands and priorities. Oh, that couldn't be true for behavioral health, could it? Motivate and inspire in a world of constant change. That's every day now in the behavioral health world. Accomplish difficult assignments without the necessary resources. Hey, we've been doing that for about 70 years. But at the outside world, the for-profit world has that same challenge, 45% of the executives. Balance the needs of the organization with those of the individual. Bingo, that's a big one for us, because sometimes we balance the needs of the individuals and not the organization. Therefore, the group practice struggles, while the individual programs or individuals within the group practice thrive to a degree. And then adjust to a faster pace and more multidimensional job. I bet you haven't had to do that in the last 3 or 4 years, have you? But can you see that the outside for-profit world has the same challenges that we now face in behavioral health? And you know why? Because our external requirements are changing rapidly. We went through a lot of decades where our external requirements under the old grant funding and fee-for-service funding didn't change a lot. But boy, has it started to change since early 2000 and mid-2000s. Also, the leadership skills needed survey for the AMA again, there were 4 given as the top 4. There were probably 10, I think, on that total list. I just pulled the top 4. Communication. 84% said you have to be a good communicator to be a good leader. And so again, that's the most important skill, is communication. Now that's in the form of obviously verbal, but also written. And what I want to talk about is that we cannot overwhelm our staff by sending them large magnum opus emails, 20 pages that take 15, 20, 30 minutes to read. We can't overwhelm them with communication. It's not simple enough. It's not focused enough. And we tend to really be very verbose, you know, and I'll share this with you, the for-profit versus the nonprofit. But in the for-profit world, we had to write in bullets. In the nonprofit, when I got there, I was encouraged to write in chapters of books. It was amazing how much documentation everything had to have to get the point across, which candidly was confusing our staff in many respects. I need to be able to motivate and inspire others, 56%. I need to have team building skills, 46%. And I need to be a visionary. I need to be able to look at the horizon and see where we need to go as an organization, 42%. Now, what is leadership? I pulled here a couple of definitions and one out of my book, but I think these are very important. When John Agno, again, you can look him up online, has done some great work in leadership skills. This is in a for-profit world. But basically, he says the ability for a leader, ability to communicate, manage conflict, and inspire loyalty so that people believe in your goals and have a desire to remain on the job, to work with you towards those common goals. In other words, do you inspire others? Do you actually manage conflicts in such a way and you communicate in such a way that others are inspired by what goals you give them and what goals you have, and do they desire to be there to support you? That's the ultimate definition of a leader. The second one here, again, Agno, leadership, and this is a powerful one to me. You talk about the difference between supervisor role and manager role. Is leadership is an interactive conversation that pulls people toward becoming comfortable with the language of personal responsibility and commitment. And I was asked, one of the questions in the registering was, you know, how to deal with millennial and Gen X teams. And part of it, you know, and again, we'll talk about this more. I know Michael will in his webinar, but the concept here is how do you take all staff and how do you have an interactive conversation? I'm going to talk about how to do that, that pulls them to becoming comfortable with the language of personal responsibility and commitment. That's a very important one because, by the way, if you do that, you move out of a supervisor role to a management role. And when you do that, you're at risk. It's a risk change for you. Supervisor, and I'll talk about it, is not a risk environment at all. It's just, you know, I'm here and I'm going to process crisis over and over and over. Manager is I'm going to identify what's wrong and do something about it. And that's risky. Now, Tom Peters says leaders don't create followers, they create more leaders. And that's very important. One of the things as a CEO of the corporation I was in for 13 years, my main work objective each year was to work myself out of a job. That was in my work goals. I had to work myself out of a job. I had to report to the board of directors of this corporation what I did each year with which staff I did it with to help them to become competent to do my job. Now, at first that was very threatening to me, but what they were trying to do is to get me to understand that I could teach people through delegation of authority and responsibility so that I could free myself up to be what? A visionary leader. You can't be visionary if you're bogged down with everyday tasks. And then finally, leadership is the willingness to assume the risk of matching the authority to lead with the responsibility to lead. And again, I'm going to touch on that more, but what I found in the for-profit world is we were given the authority and the responsibility. What I saw in the nonprofit world, most of the time staff would assume the responsibility but not the authority. Because if you assume the authority to make decisions, by the way, you're at risk. And what if I make a bad decision? What if I make a wrong decision? So I want to play on that one a little bit more. Here's kind of a comparison. This again is explained more in the book, but I just wanted to show you because I think these are very important to look at in terms of basically, and I'm going to pull this up, but basically for a for-profit manager leader for 25 years, we had a direct correlation between the level of responsibility to manage and the level of risk-based authority to execute. Meaning if I was given responsibility, I was given the authority to carry it out. What I found in the behavioral health world is that the primary focus was, this is your responsibility to manage it, but I didn't have any authority. I didn't have the authority, it wasn't given to me, or if it was given to me, I wouldn't assume it, because when I assumed the authority to decide and execute and implement the pilot program, it was risky. I didn't want the risk. So again, it's a totally different concept. And you as a supervisor, manager, leader in your organization, where are you? Which side of this level of authority and risk are you on? Responsibility, you know, the first time I went as deputy director, I was given the responsibility to do 1, 2, 3, 4. What I didn't get in that memo from the director was my authority. So I went to his office, knocked on his door. I said, excuse me, Tom, I understand my responsibility, but I need for you to give me corresponding authority. You need to delegate to me from your authority what you're giving me the authority to do in order to carry out these responsibilities. That was a whole new concept for our organization. It was like, what? No, if I'm going to go down and say to the adult program, we need to do this and this, I need the authority to do that. And so those are some of the things about, again, a nonprofit world that you might want to look at as a management team. How much responsibility without authority is happening? I could, taking risks, risk-taking as an expectation and trained skill in the for-profit world. In fact, my compensation was based on the amount of risk I took and my timely decision-making. Whereas risk aversion in the for-profit, nonprofit world seems to be accepted. Risk aversion means don't rock the boat. I'd been at this behavioral health center about a year, and one of the old long-term staff came to me and said, David, you're rocking the boat here, and that's not good. And I said, what do you mean I'm rocking the boat? We have 600 people who can't get into treatment. Yeah, we need to rock the boat. Well, but you're rocking the boat and people are upset. So don't rock the boat. Basically, don't make a mistake. Don't get people upset. Just keep your time here and you'll retire one day. Does that sound familiar at all to the culture that you might be involved in? And it's a very important thing to recognize if it's there. Trained to communicate an executive summary, I needed to write in bullets. I was told, again, I'm not to write in paragraphs or chapters. I was to write in bullets that could be explained in a very short period of time. And when I got to the Behavioral Health Center, I was told that my emails were too short. And I said, what do you mean? Did you understand what I was trying to get across? Yes, but we need more information. I said, but that's for you to find out. I'm assigning a task is for you to do, but we want more. We're used to having more. And all I'm saying is that at some point, what is enough? I think this is the key. Sometimes I see when we do assessments of email systems and email protocols in behavioral health centers, we exhaust our staff with the exhaustive nature and length of our emails. And we send it to everybody, all 27 people. And all 27 people respond back. All I'm saying is there's some real important work that you can do here to lower the clutter in your daily work life. CQI change management, continuous quality improvement, means we're going to come up with a pilot idea and we're going to implement it next Monday, and we're going to monitor it and see if it works Monday by lunch and Monday afternoon, and we're going to change it and make it more effective based on this evaluation that we're doing. That's CQI. What I learned in the Behavioral Health Center, we had QI, quality improvement, which meant that no one could move forward with any project until everyone was happy with it. Are y'all familiar with that? Dr. Jones said he does not think this would work. Okay, so the whole team stops. We don't do a thing. And it's based on subjective anecdotal information. You know, I got there, we had changed from grant funding to fee-for-service funding, and we didn't get paid until we delivered a service and submitted the claim. That was in 1991, and our agency was literally going bankrupt when I joined the team in 93, and we couldn't pay our payroll, and we were going back to the county every quarter for more money. And I said to the management team, I said, you know, what is your no-show rate for ongoing therapy? And the managers looked at me. They looked at me like I was kind of like, what? And I said, what is your no-show rate, you know, this past month, this past week for individual adult therapy, outpatient therapy? And one person finally said, oh, our no-show rate's much better than it used to be. And I said, so what did it used to be? And the answer was, much worse than it is now. Can y'all hear that? There is no data It's all subjective. It's all anecdotal. You know, April said if we do this that nobody will come. Okay, but we had anecdotal information. Are people getting into care? Oh yeah, Bill said it's much better now than it used to be. Well, what did it used to? What is it now? We didn't know that, but we had to make sure that everybody was okay with everything. Again, if you're in that culture, that is not leadership. That is not management. That is really supervisor model. It's called processing, and I'll define the supervisor model in just a minute. And for-profit, we do our knowledge of cost and services. I had a report on my desk every Monday morning as CEO for every item we sold, the cost, the actual inventory on hand, and what we were selling it for, a profit margin. And when I asked teams, what does it cost for you to bring one client from first call for help to treatment plan completion, you would not believe how many people don't know the answer to that. And so what we've done for years now is to actually go in and assess what it's costing you in staff time and staff wages and in time, daytime and hour time. So it's so important that we can use the data to make a change happen. Get rid of that. Now, the biggest challenge is I was asked by the National Council several years ago to serve on a national program or national conference on a panel. And the moderator was going to ask us some questions about healthcare reform in the behavioral health industry. And the question that was asked is, in the next 5 years, what do you see are our biggest challenges? And these are the top two was exactly my response. I said, first, the willingness of managers to continually step across the threshold of risk to make bold and creative decisions. And secondly, the need to make tough decisions in an era of change and stick with them in the face of staff challenge. And that's really important. And I'm going to break that down further so you can identify where your center might be in this area. And then with that, we then had some discussion about what do you mean tough decisions? I said, well, decisions that really staff are not very pleased with at first. How do we make those and not be based, and I'm going to go back just a minute, not be based on anecdotal, back over here on the right, number 4, anecdotal, and Sue's upset and Bill's upset. And they said, if you change this intake process that, you know, Sue, who's been here 27 years, will leave. I don't know if y'all ever heard those kinds of things, but that is not, again, a healthcare practice as much as it's a loosely held federation of private practices and practitioners in programs. So what tool, number 3, what tools are needed to support minimizing leadership decision risk? Because risk decisions are risk-based. And so many times, as I said, we don't make decisions because we don't have to. I mean, if I don't make a decision, I can't be wrong. And so the question here is what data, what information do we need to minimize those risks? And the answer is data, performance data. We have worked with hundreds of centers on developing performance standards for all staff, not clinical, just clinical. A clerical, accounting, leadership team, home-based staff, community-based staff. Everybody who works with us, we have staff performance standards up in Ohio for the staff who cook the meals in the group homes. And so these performance standards have to be developed, but then measured, because then I can see, in fact, objectively, not what Sue or Bill told me was going on, but what is really happening. And with that information, I can have more objective data to actually support my decision making, which reduces my risk in making the decision. I need objective job descriptions with those performance standards integrated into them that support key performance standards. We have hundreds of samples of key performance metrics. We typically recommend that you have about 8 to 10 key performance indicators for every staff that work with you. And that will vary if you're accounting staff, if you're administrative, if you're clerical, if you're clinical, if you're medical. Those performance standard types will change based on what you are required to do. But then you have, those are primary key performance standards. And then you have secondary or non-core, as we call them, performance standards for the benefit of the whole organization. meaning we're all going to provide ethical care. We're all going to, we all do these things, but these particular ones are core that are for that particular position or staff type. We need objective performance evaluations that provide an honest and effective system learning environment related to the attainment of the key performance indicators. And I can't say that enough. I mean, the first 6 months, at the end of the first year I was there, basically at this center, I had staff come in and say, David, I need to have this turned in by Friday. This is my performance evaluation. Can you just sign this so I can turn it in? I said, whoa, 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 whoa. What are you talking about? Well, we just need to get it signed because it's got to be in by Friday to the HR. We don't get our payroll. So all of a sudden, the performance evaluations were not objective. They were just a perfunctory, perfunctory, everybody's okay. In fact, if you looked at our system in 1993, as I said, we had over 400 people waiting for care. We had, in one program, 62% of the treatment plans were not completed by the time service began. And you know what the evaluation total out of 100 points was for our whole staff in that particular year? 94% of our staff had an excellent performance evaluation. Do you know why 94% had to have an excellent? So they could qualify for higher. They couldn't get a COLA. Now, all I'm saying is those performance evaluations did nothing to help me as a manager. See, the performance evaluations, the job descriptions, and the as you do, that is what the organization says. When you come to work here at the Behavioral Health Center, these are the things that are required. I don't have to do anything about that except coach my staff to meet them. But if I'm trying to constantly establish and reestablish and negotiate and debate performance standards, I can't coach. I need a supervision plan with supervision types and supervision session guidelines. We have supervision, I have this in the book, but we have agendas, we have supervision logs. We do things so that we're all doing the same thing and we're all doing it the same way to what? To coach our staff to meet the performance standards. D, if we're not doing D and if we're not doing C, we are being very unfair to our staff if we've assigned them any kind of performance standards or objective job descriptions that include performance standards, because we're not coaching them, we're not being honest with them about what their performance is really, and then if it's not what we want, then we can also say, what can we do about that and how can I help you? And then performance measurement with full disclosure. Oh my goodness, this was a major one, meaning how can I help staff learn? Without performance measurement with full disclosure across all staff, we cannot have systems learning. In the for-profit world, we save so much time in changing because we see what other staff are doing and we can identify if a staff is doing something really, really good. And I can go over and say, hey, can we have a cup of coffee, Bill? How are you doing this? This is fantastic performance. How are you doing this? In the behavioral health system, when I got there, our performance standards were secret. Shh, don't tell anybody. Shh, shh, shh. You can't talk about them because it will make people feel disrespected. Are y'all familiar with this culture? You can't really talk about who's doing well here so that we can all learn from them. And so what we set up is we had basically what we call a gold star, and we'd have them tell the rest of the staff how they got their no-show rate to 8%. How did you do that? Instead of all of us trying to learn on our own. But those kinds of performance measures with full disclosure really move you into a full group practice model. And it's essential if you're going to have the top A, B, C, D. If you don't have full disclosure, you're just keeping it all secret, which is not helping your system to change and system learning. And then accountability with positive and negative consequences. If we're not meeting and we've coached and we can't meet the standard, what are you going to do about that? You know, I was told in one situation, I asked the team managers, I said, how long have y'all had paperwork problems or paperwork deadline problems, turning in paperwork timely and quality? And how many of you have that? And every manager in the room raised their hand. I said, let me ask you a question. how long have you had those challenges with your staff? One person said, 21 years. I said, really? They said, yes, since I've been here. And I said, so how much longer do you plan to talk about it before you act on it? Can you see the difference? And that leads us to this one. And this is important because if you look at the role of a supervisor, of a manager, of a leader, coach, mentor, if you look at those roles, I want to define why all of the things I've said so far, and this is a cumulative presentation, I mean, I'm going to keep building, but why it's so critical. Because if, in fact, I don't care what your title is, you could be a manager, you could be a chief operating officer. Excuse me, I was looking at a lot of the attendees. We have over 500 registered for today, for today's session prior to starting. So I looked at all of your registrations to see what roles you play in your organization and what roles you have. But I don't care what role you have. I'm talking about now how you carry out that role. Do you carry it out as a supervisor role model, as a manager, or as a leader, coach, mentor? And that's very different than the title you have. A supervisor model is that I react to things and I look at retrospective problem solving. Basically, I look at things and all of a sudden I go into my office and, oh, David, we got a problem. What's the problem? Well, so-and-so yesterday this happened. So I dive into trying to fix yesterday's problem. That's retrospective. I react. I got to constantly react. You know, I honestly found, and again, I was CEO of a multinational corporation. We had 3,700 employees, and I could actually get out of my office and go to the bathroom without being stopped. I could go to lunch without being stopped. I could actually leave the building without being stopped. I became deputy director of a community behavioral health center, and the minute I pulled into the parking lot, I had staff coming out, David, I got a problem, I got a problem, I got a problem. I could not make my way to lunch without being, I got a problem, can I talk to you? There was nothing but constant crisis. Let me say this genuinely, that is not a healthy work environment. And candidly, in my opinion, is not normal. Because I worked in a work environment and for the for-profit world that we didn't have all that crisis. And when I got to the behavioral health center, we were all overwhelmed and tired. And all we seemed to be doing, he or she, we were processing crisis. We were talking to the same staff next month that we talked to last month about turning in your documentation. We were talking to the same staff and same program issues over and over. Are y'all familiar with this? I wish I was standing in front of you because you could shake your head yes or no. But the point is, if in fact you're processing those crises and over, the only role you're playing is supervisor. You're supervising the chaos because that's what it is. It's nothing but chaos. You know, do you ever come to work tired? Do you ever leave work exhausted? You know, I worked for 25 years. I didn't have the exhaustion I had after 2 weeks as a deputy director of behavioral health center. I was exhausted because there was nothing but emotional crisis after emotional crisis. Now, let me say, some of that was client-centered and appropriate. But you know what the majority of that crisis was? Staff interactions and staff individual crisis. And I want you to really fairly assess that for your organization. Where is your crisis? What produces your crisis? Is it really your clients? You know, in some cases, our staff were in more crisis than our clients. And again, I'm not belittling here. I'm not making fun here. I'm saying we had a problem that we had to address because we were supposed to be the staff. We were supposed to be the ones managing the crises, not creating the crises. So a supervisor just retrospective, just goes back over and over the same things over and over again, reprocessing, re-talking about it. We had a paperwork reduction committee, and I was assigned to be on that committee. And so the first time I went to the meeting, I said, so what are we trying to accomplish here? And they said, we're trying to standardize our paperwork. At that point, we had 16 different treatment plans. We had hundreds of progress note styles, and everybody had their own. Everybody was very proud of their own. And we had all kinds of assessments. You know, had about 8 or 10 assessments. And it took forever to get people in. And we said, you know, we need to standardize this. I said, so how long is this paperwork reduction committee? Catch the title. How long has it been meeting? And the answer was 2.5 years. not 2.5 weeks, not 2.5 months, 2.5 years. And I said to them, so what have you accomplished in 2.5 years? And they said, well, we've decided that we really do need to do some work. And I said, so it's taken you 2.5 years to decide that you really need to do something. So what are you going to do? And they said, well, when we talk about it, people get upset, and so we just kind of back off. And the answer was they had done nothing but meet 2 afternoons a week, 2 hours each. You know, I total up the number of staff hours and the staff cost for them to meet 2.5 years. It was $86,000 in 1993. And you know what we spent that money for? Zip. That is called problem solving, processing crisis over and over. That is not management role, and that is not a leader role. Now, the manager role is you have a dynamic awareness of current issues. What's going on? For instance, I ask my program directors every Monday morning to put on my desk how many people reported needed service last week, how many got into service, what service they were requesting, and how many did not get into service, and what service could they not get into. And then I asked them to put that on my desk every Monday morning for their program. When I first asked that question and gave them that directive as in writing, guess what the manager said? We don't know the answer to that. I said, but you're going to have to figure out how to measure it. Without that data, we can't say that people are getting into treatment here. We can say that we're doing better than we used to. Oh, it's much worse than it used to be. It's much better now than it used to be. We can do those kinds of things, but I really want to know how many people. And then my question to you as a manager, what are you going to do about it? You see, if they have the data about what is happening on the intake, then they can provide a proactive, solution-focused decision-making model. They can actually say, if in fact our bottleneck is here and we can't get people in, then what are we going to do to solve it? But as long as I'm out there in the world, it's much better than it used to be, I can't solve anything. All I can do is discuss it and process it. I can't make a decision about it. Therefore, if you have this data, she or he can manage complexities. And I think you would agree, if we look at our behavioral health centers today, particularly with integrated healthcare, we're far more complex in our delivery needs and in our requirements than we were forever. I mean, just in the last 5 to 10 years, it's amazing how much more complex we've become. The third role is a leader, coach, or mentor, and I put those together, and I talk about that a lot in my book, but I think a leader is really a mentor. A leader is a coach. A leader pulls people. A supervisor pushes people, and I'm going to talk about that a little bit more. But a leader, coach, mentor possesses the dynamic awareness that the manager has, but they use that information to envision possibilities for the organization. A visionary leadership role is someone who's constantly looking at the horizon to envision where the organization needs to go. What's happening out there? What's going to happen with the Medicaid Reform Act in our state? What's going to happen with the MCO new contract? What's going to happen? Where do we go? How do we engage? That person needs to be able to see where the landscape is changing and be able to adapt the organization to that requirement. Now, it's important. If you are in the weeds, if you are a manager that's in the weeds, or if you are a supervisor who's constantly in the weeds of crisis, you cannot be a visionary leader. You can't see outside the weeds that you're in. I've got to manage and delegate my requirements and manage so that I can free up some time to get out of the weeds and the internal process crisis and then basically look towards the horizon. Where are we going? And someone or ones in your organization needs that role. It's a critically important role because therefore he or she manages and sustains change. So I guess the question, and again, you could ask this of yourself, but I would take this slide, and the slides will be available, and I'd ask you to go around to every member of your management team and ask them to assess which role they're playing in your organization. Forget their title, it doesn't matter. What role are they playing in your organization at this time? You see, the manager leader role on the left is you lead staff into change with enthusiasm and encouragement and coaching. You know, I know these standards are new and I know they're different, but I'm going to meet with you weekly and I'm going to work with you to coach you to meet these standards. I'm not going to say, here are your new standards, good luck with them. That's not leadership. That's unfair. But I'm going to say, here they are, and I will work with you every week in supervision, but I'm going to have regular supervision. We're going to have a supervision agenda, and we're going to talk about where the challenges are and how I can help you meet them. The supervisor is a collective bargaining agent on the right. Basically what I see there is that the supervisor role, again, it's a role, basically agrees with the staff, openly or privately. And the change initiatives are unfair. It's just unfair that we have to do all this change. I bet you've never heard that, have you? They don't promote quality. I mean, you're not promoting quality here. You're unethical. When I talked about performance standards for clinical staff, I was told in 1993 that I was unethical. I said, what? I'm trying to help our clinicians see clients. Is that unethical? Again, it's the concept of the culture. And if it's a supervisory culture where everything is processed and everybody's opinion is important and everybody has to be happy and satisfied with every decision, you will never, ever, ever be able to lead change. Personally involved in providing additional efforts. Manager leader role. I'm during the implementation phase. I have to be available. You know, basically we set a standard that managers' offices doors couldn't be closed during a change initiative. We had to have the availability for staff to come and say, here's what's happening. It's not going the way we intended. What should we do? That's called CQI, continuous quality improvement, and make a decision right there to change it and go forth for the afternoon. The first time we went to same-day access, we had a meeting every hour of the first Monday morning to see how it went, what we could do to change the next hour. But we actually, by the end of the first day, we had refined that same-day access to pretty good. And the second day, by Thursday of that week, we had a model that they still use. But we wordsmithed it, but we made decisions and we were available. What we do see in the supervisory role is kind of like they watch the change initiative happen at the edge of the pool. I'll give you my classic story. I was consulting with a team, and I had been with them several days, and so I went out at a break. We just took a break, and I walked out, and this particular director was director of substance use disorder services, and he really wasn't plugged in. He wasn't plugged into discussion. He didn't seem to want to be there. And so I said to him, I said, now this, by the way, is the manager of a large number of clinical staff. And I said to him, so what do you think? How do you think we're doing on this change initiative? And he said, I got it figured out. I said, what have you got figured out? He said, I've looked at your contract and I only have to put up with you for 3 more visits. And I'm willing to do that until you leave, and then nothing's going to change. Do you hear that? In other words, this manager wasn't a manager, was he? He was a supervisor. He was agreeing openly with the staff that this is unfair. You shouldn't be here. And I'm just going to stand here at the edge of the pool and just watch everybody kind of go crazy until your contract is out, and we'll just go back to doing what we've always done. Now, that's an important thing. If it's in your organization, it is truly, truly dangerous in today's external change environment. And you need to identify it and identify what you can do to change it. And then finally, a manager leader utilizes measurement to inform decisions, whereas the supervisor relies on anecdotal information. You know, Bill said this, Sue said that. You know, most of the people here like it this way. Oh, we used to do it that way, but nobody liked it. Are you familiar with that kind of anecdotal model? That's what's getting us into trouble because we're not leading. We're basically just processing over and over crises. Now, I can send you this document. This is one of the ones I mentioned. Excuse me. This is actually a leadership effectiveness to support change management assessment for you. And what this does, and you can complete this as an organization, just ask me for the change management decision-making effectiveness. But you just have it circulated to all your managers and just sit around and say, does the clinic that I work in or the center have a defined decision-making process or protocol? Can we actually define how we're going to make decisions? You know, is it going to be majority vote? Is there going to be basically someone makes a motion and somebody seconds the motion and then we discuss it and then we're going to vote on it? Or do we have to make sure that everybody in the room is okay with it? And if Sue is not here, we can't make a decision until she gets back into the room next week. That is not a decision-making process. And if you do, that's great. If it's no, what are the primary indicators in your center that a decision has been made? How do you know a decision has been made? Secondly, does the clinic use a formalized annual planning process to identify annual and long-term goals? Yes or no? If yes, what percentage of the goals and objectives are incorporated in your last annual plan? What percentage have you accomplished? That's an interesting question, by the way. Has the clinic used rapid cycle change management process, plan, do, study, act? Yes or no? And if yes, what percentage of the goals are incorporated in the last rapid cycle change plan have been fully implemented? That means we planned, we did, we studied it, and we acted if we needed to change it, but it's fully implemented. Now, these are very important. 4 through 8 are critical important questions for you as a management team. The clinic develops a change management plan quickly and moves forward with timely decision-making about the solutions needed. Is that true or false? If it's false, what is more true? When a decision is made to change in the organization, the clinic acts quickly to fully implement. Catch that word fully. Not partially, not some of us, all of us. Is that true or false? When change is implemented, staff members in the clinic rarely retreat to the way things were done prior to the change. That's called retreating, the retreat culture. We got it going, and then 2 months later, we're right back to where we started. Is that true or false? Do we rarely retreat, or do we always retreat? The clinic does a great job evaluating changes, implemented and modifying the changes as needed to ensure positive outcomes. Do we really evaluate the change? Do we see if it's really working? True? And if not, what is more true? And what we have found across the years is a lot of teams will change, but really don't evaluate the change to see if it's really working and continuing to work. And 8, staff members participating in the change process feel fully empowered through a sense of attainment based on scope and timeliness of their decisions. They feel fully empowered. We got together, we had a scope of work, we did it within the time frame, we made decisions, we piloted, and we are fully implemented CQI. Is that true or is it false? And then how, from a 1 to 10 scale, how difficult or easy is it to change with the clinic implements change in the areas of clinical practice and in the areas of clinical practice standards? If you take this document and just literally hand it out and ask your management team to address this and come to some conclusion of where you are, this will tell you, by the way, if you are a supervisor role-based agency, a manager role-based agency, or a manager leader role-based agency. It will tell you very quickly. And I hope that makes sense now. The changes, the acceptance of change, a lot of teams tell me, David, you don't understand, it's so hard for us to change and it just doesn't work for us. And I call this leadership blinking. And I've had a lot of fun with this drawing. I've changed it over the years. I did this one the first time in about May of 1993. I sat down and I remembered in my clinical training days, I went with Kubler-Ross, Grieving, Death, and Dying, and I thought, what's going on in this organization? I had 286 clinical staff. I said, what is happening here? And what I picked up on was that we were going through a grieving process. You know, we had been the same for so long, and so many individuals had been doing the same thing for so long. So many individual programs had been doing the same thing for so long. When we were asking them to become a group practice, it was like we were asking them to literally pick up the building and move it 2 feet off its foundation. I mean, it really was, it seemed to be impossible. So the first reaction I saw within staff was denial. No, we don't need to change. We did that 10 years ago, David. You're new here, but you don't understand. We tried that 4 years ago and it just didn't work. In fact, Bill and Sue said if we did it again, they would leave. Again, I don't know if you've ever been held hostage, but that's what being held hostage means, is that staff will say, if you really try to change this, we just won't do it, we'll leave. That's called being held hostage. It's a very unfortunate position that a lot of supervisor role staff are in, because it's a no-win situation for you or for the organization. Well, no, we really need to change, and here's why. Well, why do we need to change? Because we have 462 people waiting to get into our treatment services. And so we're going to implement this new standard, and we're going to implement it effective next week. We're going to pilot it all next week and the next week, and then the next step happens, negotiation. Well, David, I really appreciate your thoughts on this. And this is actual conversation I'm recalling to you. My child and adolescent director walked in my office and said, I really appreciate this new performance standard of 1,200 billable hours for clinical therapists. And I appreciate that. And I know that you mean well. But, you know, my staff cannot do that. And really, I've talked to them this morning, and we feel much more comfortable at 980 hours per year, not 1,200. Negotiation. Now, a supervisor will negotiate there. Oh, your staff can only do 980? Well, why? Well, they're just overwhelmed, David. I mean, we're all overwhelmed. The question is, if they're overwhelmed, what are they overwhelmed doing? And as a manager, your job is to find out, look at the data, and change their practice. For instance, we had clinicians writing journals instead of progress notes. We had people filling out assessments that were unbelievable. These things were 24 to 30 pages long narrative. Why are we doing this? What about checkoff and short narrative? Why don't we look at changing the tools if our staff are so overwhelmed with paperwork? But my job is not to negotiate the standard based on current practice model. My job is to understand as a manager leader that we can change the practice model, but a supervisor will negotiate. And therefore, no, you're going to have to do it. You're going to have to do it. And so the staff then go to anger. Well, this isn't fair. And then they start blaming. Well, that's the new deputy director. His name's David. Look at what he's doing to us. Or it's the outside. It's the governor. It's the president. It's Congress. It's Medicaid. It's everybody in the world but us. And that anger blaming goes very, very quick. And it gets very heavy and it's very emotional. You see, 1, 2, 3, and then if we don't address the anger, then you start hearing staff say, well, I'm just going to leave. I'm not going to do it. Are you going to do it? Bill, are you going to do this? And I would walk down the hall and hear those conversations. Are you going to really do this standard? I'm not going to do it. And so we had dropout. It's awful. And the question I asked the staff, where are you going to go that will allow you to not do your documentation, that will allow you to bill about 50 hours, 600 a year, 700 or 800 a year? Where are you going to go that will pay you full-time salary and benefits and retirement? I don't know of any place that you can go today, but they had to understand the reality of what was out there. And some of the staff said, well, I'm just going to go into private practice. And I said, please don't do that. You're going to have to bill about 1,400 hours to earn your keep. So, you know, if you're concerned, then let's start talking about what we can do to change it. Now, here's the point. In a change initiative, if your staff are emotional, and it gets very emotional and very sensitive around the center, it's because you're still in the 1, 2, 3, or 4 cycle of change. Supervisors will try to push staff through, and you can't do it. You can't do it with negotiation. You can't say, don't be angry. And I had to understand, my adult director came in on Friday and told me exactly what he thought of me. I understood where he was. He was angry, but he came back Monday and we had a good talk. But we were trying to get through and change the process within the Adult Services Center. All I'm saying is it's going to be emotional. And what tends to happen, it's called the 1, 2, 3 dance: denial, negotiation, anger. And as soon as staff get angry, we go right back to negotiation. Y'all familiar with that? Oh, we're not going to really do same day, are we? Oh, yeah. What? We're going to do same day? No, we're not going to do same day. Well, I thought we were going to do same day. Oh, no, I think Sue told us we were going to have to do it anymore. Right? We are going to have to do it. We're angry. The 1, 2, 3 dance is where most organizations stay in change. And it really is so unfair to the staff that you're asking to change, because there is nothing but negative emotion. 1 is negative, 2 is negative, 3 is negative, 4 is negative. Only when you get to the staff accepting that they need to change do you get to a neutral emotion. And only when you get to 6, where the staff are excited about taking advantages of the opportunities we're going to have because we changed, is when you get to a positive emotion. And this approach by managers and leaders pull staff through 1, 2, 3, 4, 5, and 6 because they are there. Managers have to start at 6. Managers don't have liberty to be up here negotiating what their teams are going to do. In other words, if I've got a manager of a particular program who's coming back to me and saying, my staff can't do 1,200 hours, they can do 980, that manager is not going to lead the people and pull them through change, their staff. They're going to continue to negotiate so their staff will not get angry. I really want you to print this one out, and I want you to really decide, where are you on this 1, 2, 3, 4, or the 1, 2, 3 dance? Denial, yeah, we got to do it. Well, why can't we do it this way? Well, you can't do it that way. Anger, okay, well, let's do it that way. Let's try it that way, and we'll back off, and then it just goes round and round. Again, I really hope, just to be honest with yourself, how much of this defines your organization's culture? And if I've defined it pretty well, then you got your work cut out for you, because you really need to move from a supervisor role structure to a manager leader role structure. And that means we're going to pull people through the change. And then I've tied in the 1, 2, 3 dance. It's a very hard dance because staff get tired, they get fatigued, and they say things like, this organization is never going to change. And that's so unfair to the staff, because what we've told them is, as soon as staff get angry enough, I call it the ooh factor. And one staff, I said, what is it like here? She said, well, we figured it out, David. The more we ooh, the less we do in change. And I said, what do you mean? They said, well, if we get emotional enough, anger, number 3, then you'll back off. That's what we've learned from our past culture and our past supervisory culture. Staff get angry enough, then management backs off. If you do that, you've really been intimately unfair to your staff, but also to the organization that's employing you to be a manager. It's very important to look at that. I looked at typical management challenges. I started years and years ago with Ohio State University. I worked with them on again, leadership in the Behavioral Health Institute up there. And I would ask managers who attended to fill out, to write down their top 5 challenges as a manager. What do they find every day challenges them? And the first thing I found, and the biggest one, by the way, was perfectionism. Everything must be done 100%. It must be exactly right. It was almost like a fear of making a mistake. If I make a mistake, then I'm wrong, and oh my gosh, what's going to happen? And this perfectionism, and by the way, my name is David, and I am a recovering perfectionist. But I really mean that. I've had to overcome having to do everything just right. And that's why I have to write chapters in books. It has to be perfect. It has to be the perfect document. It can't just be a document that we all learn from. It's got to be the perfect document. If perfectionism is in place, number 1, then typically that person, that manager, will lack confidence in self and abilities. It's almost like if somebody would walk in and say, David, you really don't know what you're doing here, CEO. And I go, oh, but you found me out, man. How did you know? How'd you know? That lack of confidence is down deep. And if the lack of confidence is there, it's typically because I'm trying to be perfect. I'm trying not to make a mistake. I'm not trying to use the intellect I was given, the experience that I've been able to gain, and the confidence that the organization placed in me and the role I'm playing to make a decision. I'm waiting to make sure I'm not going to make a mistake. And if I lack confidence and I'm a perfectionist, then I lack the ability to delegate. Over and over in the for-profit world, I was told by the chairman of the board that I needed to learn to delegate in my annual evaluations. And so finally, he sent me to a school for delegation. He said, I'm not playing with you. And he said, if you don't learn to delegate, then I will terminate your role here, because you're not training people to become leaders like you. You're training people to just ask you questions so you can answer them. See, that's not a delegation. Delegation is to give them the tools, give them the experience, give them the tools and tasks, and give them the authority and responsibility to help them grow into the role over time. You know, my job when I retired was to have designated 3 of my staff to take my place as CEO. That was my job as CEO. And for the last 4 years I was there, I evaluated each one of those 3 individuals. And one of those individuals was chosen by the board to take my place. But it was because I had delegated and let them learn what I was doing, instead of me carrying all the information and just saying yes or no, do it this way, do it that way. Number 4, people pleasing. I can't say no. And this is a critical one. How do I say, and I've had managers say, how do I get people out of my office when I have a deadline and everybody's standing in there and talking? I said, you say, excuse me, I have a deadline and I need for you all to leave my office right now. And if you have any particular need, touch base with me later. I'm going to have about an hour here to finish this task. Well, people will be upset. Well, they're just going to have to be upset. I mean, this is called not people pleasing. It's called setting boundaries. And you, the manager, if you do not set boundaries for yourself, you can't expect others to have boundaries and basically to honor and recognize your boundaries if you don't set them. Emotionally involved in staffing issues, emotional detachment issues. And I found this a lot in my work with behavioral health centers. We tend to know a lot about what's happening in the staff's individual life, what's happening in their marital environment, what's happening with their children, and all of those things are nice. But in some cases, it's basically, why did you let this staff do something that was illegal, such as treat clients without a treatment plan? And the answer I got was she had broken her toe, the staff had, and she was on crutches, and she didn't really have the heart to tell her she had to stay late and get her treatment plans done. Did y'all catch that? That's called number 5. Number 6, if 1 through 5 is happening in your daily life as a manager role, a supervisor role, you will be burned out. It will just be the date. You just have to select a date. When I was 31, my date was in April of 31, when I was 31 years old. I just didn't want to go to work anymore. I had the flu. I had a bad case of the flu. And finally, the chairman of the board came to my house after a week of me being in bed with the flu and knocked on the door. And I went to the door and I said, I had to sound sick. You ever sounded sick on the phone when you called in? I've got a bad flu. You need, don't come in the house. You can get sick. And he looked at me and he said, I don't think I'm going to catch what you have. I said, what do you mean? He said, I don't think you have the flu, David. I think you're tired. I think you're burned out. Why don't you take about 3 weeks, and I need for you to unplug. You worn yourself out with 1, 2, 3, 4, and 5. And here's what you need to ask yourself, managers. If you really don't look forward to going to work every morning, if you get up and go, oh my gosh, I got to go back out there, and if you can't wait till the end of the day to get out of there, then burnout will happen. And I would like for you to look at 1, 2, 3, 4, and 5 to see if some of those issues are in play here. I need to hold staff accountable. That's really difficult. It ties back to people pleasing. I have to hold them accountable. I have to present staff with negative feedback, not just positive. I have to say, this is really good. However, these things we're going to have to work on in supervision. And I have to be honest about that. I can't be people pleasing. It's just, here it is. I don't have to be cruel. I didn't say that. I'm saying I have to be candid and I have to be honest. The one thing I wanted my staff to know is that I would be candid, not cruel, not hurtful, candid, which means I was going to talk the truth as I saw it. Based on what? Data, not based on my personal opinion, as much as possible. Time management issues, there's a whole nother section of training that we do on just time management challenges and how to resolve those. Unfairness of the workplace due to change, that's a tremendously interesting one, is that the managers feel that it's unfair that the workplace has to constantly change because there's nothing the organization can do about that. The organization is a part of a system and the system is changing nationally now. And then the balance between authoritative and assertive. Authoritative is do what I'm saying and don't ask me a question. Assertive means here's some task, here's some information I have. What do you think? Don't you think this might be a good solution? That's assertive. And so again, these typically are the top challenges. And in part of the on-site work we do is we go through these challenges and we ask the management team to list their own individually, and then we put those in a matrix and we come to coach around how can we overcome them. That's a very important part. And then in that process of coaching over the years and working with teams, I developed basically a set of performance, behavior, aptitude, and attitude, if you will, roles, or if you will, leadership characteristics or qualities. And I would say that this type of list, you know, while it's objective, is really a very important thing for you to consider kind of where you are within this mentoring coaching environment. And in terms of, are you able to mentor and coach based on your leadership qualities in the performance, behavior, aptitude, and attitude areas. So what I've done, and I've just done it simply here, again in the book, it's more broken down and narratively intense, but basically leadership performance requirements. If I want to be a leader, what are the typical focus areas of my leadership performance requirements? Number one, I have to be willing to make tough decisions. If I don't make tough decisions, I'm not a leader. If I'm trying to get everybody happy with it and everybody has to vote yes before we can move on, that's not tough decision making. That's called processing and crisis. I need to be willing to stay with a tough decision. Is it, I know staff are concerned, but we aren't going to back off. We're going to evaluate why we're not able to meet this new performance standard, and we're going to try to coach people to the standard, but we're not going to change it. Remember that denial, negotiation, anger, we're not going to change it because people are upset. We're going to come back and we're not going to negotiate it. We're going to basically say, why aren't we meeting it and what can we do in our supervision to meet it? Number three, a willingness to change based on the evaluation of outcomes. Now, if the outcomes show that this same-day access model really isn't working, then what are we going to do about it? I can't say we made a decision and everybody, because I made a decision, you can't change anything. No, no, no. We made a decision based on the information we had at the time, but if it's not working based on evaluation of outcomes, let's change it again. I have to give up ego. I have to give up ownership as a leader of a decision if I see it's not really working. Never-ending communication. I never end. I have to constantly ask questions. I have to constantly answer questions. It never, ever is ending. And I can't say, well, I've already told you this 3 times. Now, I will do this. If my staff team has asked me the 3rd time the same question, I will put my response in writing, circulate it to them, and say, this is the answer. A lot of times, staff want to re-question you on the item to get you to change. It's not about not understanding what you're saying. It's about negotiating a change with you so it's brought up in the concept if I didn't understand it. Accuracy, I have to be accurate, number 5. I have to have ability to use objective information. And this is really important. If you don't have information, start collecting it. I used in the old days Lotus 123. Excel is a big tool that we use in MTM now. There are other tools that are available. Just start collecting information so that you're not saying, what do you think? Well, what do you think? No, here's what the data shows in terms of what our no-show actually was last week. And here's how many appointments we scheduled, how many didn't show. What are we going to do about that? Knowledge of outcomes being achieved. I have to be knowledgeable to be a leader. Now, the behaviors I have to have are very, very important. I have to be fully involved and supportive of staff. I cannot sit on the sideline and say, go staff, I'm not in the game. You have to be in the game. I have to be with them. I have to be moving around. In fact, in a change initiative, I will walk the halls. I will go around. How's it going? Any questions, any things that I can do? In other words, I'm constantly encouraging them to move forward with this change. I don't announce a change initiative and sit in my office. That's not a good coach mentor. Coach mentor is there with them and coaching them every minute of the day. I asked one manager, I said, how long did it take you to implement same-day access? And she said, 4 days and 3 hours. I said, how'd you know that? She said, that's how long it took me to walk around the halls and answer questions. And about 4 days and 3 hours later, we had solved it and we're still using the process. That's called CQI, fully involved. I have to be a timely decision maker. I cannot abdicate my decision-making authority because I feel at risk. I have to make timely decisions. I have to be responsive to work environments. I have to be timely to work. I have to meet my own deadlines. I can't ask my staff to be there if I'm not there. And it's real important that whatever standards that I've set for my staff, that I am doing those standards and doing it well, not just making it sometimes, doing it well. I have to be a good time manager. I have to look at my desk and see how many stacks I've got on my desk. So if staff come in to ask me a question, I have to dig through my almost urgent stack, or maybe it's in my most urgent stack, and I restack those things about every 2 days. If that's what you've got, it's very hard to be a good time manager, and it's hard to set priorities because I don't know what my priorities are. And again, that's a whole different model of how do you work through those kinds of issues. I have to be a good stress, anger management. An angry manager is not a manager. A highly stressed manager presents a crisis for the staff because they look at as the manager as being a challenge, or the manager got something wrong. My job, if I'm stressed or angry, I need to go to my supervisor. I don't need to take it out on my staff, and I don't need to exhibit that to my staff. I need to have appropriate boundaries with staff and clients, and I really mean that. I cannot be Uncle Al, the staff's pal, as a manager. I cannot be, or I can't be Aunt Sal, the staff's pal. I have to be their manager. That's what I am. That's what I'm employed to do. Now, does that mean I can't be friendly? Heck no. Does it mean I can't go to lunch? Heck no. All of those things are appropriate, but I cannot get so involved that I am not able to make a management decision because of the personal relationship I have with the staff. Solution focused in every situation. Okay, what are we going to do about this? I mean, I understand it's a challenge. Okay, what are we going to do? What are we going to do? Okay, what are we going to do? It's not, oh my gosh, what am I going to, no, how can we solve this? And then I have to have a low crisis orientation. A crisis-filled manager is an oxymoron. That means I can't be crisis-filled. I have to be enough to handle a situation. I have to feel enough. And those are the behaviors. And again, these are not earth-shattering, but I would say these are critical traits that I would encourage you to start looking at. The typical focus around aptitude, the ability to learn and change, is the knowledge of skills required. I need to be willing to let the ego go. I can't be right all the time. What about my team? I need to let my ego personally go to support team development. I need to be willing to learn, ability to change. I need to be willing to teach and provide leadership to other clinical staff and programs. I mean, my job is to teach up other staff to become leaders. My job is not to be the leader until the day I retire and there's nobody left. That's basically aptitude, ability to learn and change. Attitude, this is the critical one. I can honestly, I can train skills. I can train performance. I can train to a degree behaviors. I can to a degree change aptitude. I cannot retrain attitude. And I've learned that after 52 years of trying. Attitude, positive, we can do this, respectful of others, cooperative, creative in solution development, flexible, responsibility matched to authority to act, meaning they're matching it up and they're willing to accept the authority, adaptive to change environments, responsive to needs of the organization and staff. They are a team player. They have a professional solution-focused approach that supports that respect factor. You see, the attitude, and I'll say this, if somebody comes in and is applying for a job, how's your day going? Oh, somebody almost hit me coming to work. Well, how was your weekend? Oh, we went for a picnic, but a thunderstorm came and lightning hit a tree close to us. We almost got killed. I'm really going to back up a minute and say, wait a minute. What is the attitude here? Because I can't retrain that. It's either in a person or it's not. If they've got a spark, I call it the spark, I can retrain that person and train dramatically to change performance, change behaviors even, but I cannot train the attitude. Now, I'm going to show you this in small size and then I'm going to bring it up. This is a tool. It's called a leadership growth assessment. It's a 2-page tool. I'm going to basically leave this and go out and pick up the tool. We have a Word version and we have an Excel version. The Excel version I brought up for you. And basically what this allows you to do is in each of those indicators that I just shared with you is you can basically go in and score yourself. Now, what does this mean? Number one, up here you can select, are you self-assessing your growth assessment? Are you asking your supervisor? Whoa, you can give it to your supervisor and say, how do you think I'm doing in my leadership growth tool areas? Or you can have others, maybe a mentor. Can you assess me? You can choose whichever you want. I'm going to choose self. But the idea here is 90-day increments. A1 is now, A2 is 90 days, A3 is another 90. So it's basically a year. And here's the thing this does. Basically, it's asking you the question on each of the indicators. If you score a 1, you do not exhibit this leadership skill at all in the last 90 days. If you score a 2, you exhibit it on seldom occasions, but basically it's just now and then. And basically, really not a lot. Now, on 3, you exhibit it occasionally, and basically it depends on the decision-making challenge, staff performance or behaviors. You back off because I don't want to upset staff. So you look at, it's almost like, what is the situation? Am I using this skill or not? Am I concerned about upsetting staff? Then I back off. I won't make tough decisions. Most of the time I exhibit this, or 5, routinely do it all of the time. And then what you do, all the indicators on performance I showed you are here, and you just come in and type in a number. And what this does is it basically scores for you. I can come in and type a 4, I can come down and make this a 3, and so I just go on down, and what it does is it totals it for that section. And your score in section A, section 1, is a score of low, which is all 1, 7, to high 35. So you can put your scores in and it will total it. Then you do the same thing with leadership behaviors desired. Same indicators I've covered with you, you just score those. And then you come down, the same thing with your aptitude indicators and the same thing with your attitude indicators. Now, what it does at the very bottom is it totals your score by, it subscores for you, but it also totals your overall score. And you have an overall score per assessment period of 31 low to 155 high. 155 high means I do everything all the time. And then it will tell you over here what is your plus or minus from A1 to A2. I would suggest you use this tool, and if you're really concerned about it, use it for yourself first, and then I would certainly encourage you to get a mentor or someone you really respect that you work with to score you as well. And ultimately, it might be helpful for you to ask your supervisor to score you, because what you're trying to do is learn. See, leadership skills are not, I wasn't born, in quote, as a leader. Somebody asked me, how long does it take you to become a leader? I said 52 years. It only took 52, because that's how long I've gone so far. You see, I think I'll be a better leader at 53 than I was at 52 if I'm willing to learn and change. Now, this is another one. It's called the leadership qualities. And these are qualities that I think our staff look for in a leader, to admire them and to respect them and to basically want to work with them and to follow their leadership. And these qualities are, first, quality of work life that's attractive to others. Meaning if I come in every day and talk about how tired I am, how I'm overworked, I don't know what I'm going to do, this is not going to work for me, I will not inspire my staff to achieve anything. They'll be more concerned about me than their job. So I have to have a quality of work life. I have to come in and I have to be ready to show up. I know there are times where I don't feel physically good, that's okay, but I have to overall have a quality of work life. It cannot be doom and gloom every time they see me and how hard this is and how unfair this is, et cetera, et cetera, et cetera. And I used to sit in the hall, walk in the hallways and hear managers tell their staff how bad their life was. And I'm thinking, what are we doing here? Are we trying to depress our staff or encourage and enthuse our staff? Awareness of the organization and the staff. I need to be aware of what's going on in my organization. I need to be aware of what's going on with the staff. You know, my performance requirements are going to show me which staff are meeting the indicators and which are not. I need to have that awareness. I can't let my staff be surprised. It can't surprise me. Did you know, David, that so-and-so is going on? No, I had no idea. Why didn't you know? I mean, that's my job, is awareness. Ability to face tough and good times with professional decorum. I have to be able to face tough and good times with professional decorum. I cannot be the one in crisis. That's not my job. My job is to keep professional decorum. That is what my job is. That's why I was employed. I need to have knowledge of subject matters. If I don't know how to use the new software, I'm going to learn how to use the new software. I can't ask my staff to use it if I don't know how to use it so I can coach them. So I can't just say, well, that's not I don't use it, so you guys learn it. Best wishes to you. I need to have knowledge. It doesn't mean I have to be a computer expert. It means I have to have knowledge. I need to be energized by life and work accomplishments. It's almost like we have to celebrate. A leader and a mentor celebrates accomplishments. A supervisor, it's like, duh, because we don't know what we've accomplished. It's all process. We're just caught in this quagmire and we don't know what we've accomplished because there's no data. But if I can say to the staff, look, we've reduced the wait list from 38 to none, yay! What are we going to do about it? Let's celebrate. Let's get energized by it. And finally, the ability to look at the lighter side of issues. It is so important. If staff are feeling victimized by their change management or the culture in your agency. I was taught years ago the only thing I can do to effectively help the attitude of someone who feels victimized is to use humor. If I can get them to find something humorous in life, then I might be able to help them. And when I started at this mental health center back in 1993, I felt like I was walking into this tomb. It was like da 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 da. It was so different than the for-profit world. But everything in this center was just so heavy and so serious, and no one was smiling. I mean, it was truly. I was concerned about their quality of life and their health. You know what I did? I wouldn't recommend this. Don't do this. I bought a it was a 1900 page. How many pages? A lot. I bought a joke book by Milton Berle. It's like a big encyclopedia. It was like 1200 pages. Don't buy that book. But on the way to work, when I stopped at stop signs or stoplights, I'd look at a couple of jokes and I'd walk in and I'd tell the jokes. Every day was a different joke. You know what my staff started doing? They laughed at how horrible my jokes were. They weren't laughing at my jokes. I just wanted them to lighten it up a bit. We were too serious here. And it really, to me, burned out the staff. It took a lot of emotional energy. I was very concerned for their health. So the qualities is the same thing. There's a total of 12. I have to have constant awareness of horizontal accountability of what's happening in organization, not only in my program vertically, but what's happening in other programs that I interact with. I have to be going somewhere versus hanging around. You know, I asked managers one day, I said, in the last 6 months, have you been going somewhere here, or are you just hanging around? And you ask yourself that. In the last 3 months, have you been going somewhere? Have you made decisions? Have you made changes that are positive for your staff and for your clients? Or are you just kind of hanging around every day? Number 9, model the values and work ethics that you ask for your staff. You need to have the same work ethics and the same values. Number 10, facilitate empowerment, pushing decision-making down. I don't know, Bill or Sue, what do you think? What decision would you make in this case? I'm literally trying to train them every day to become more and more responsible and take over the role of accountability with making decisions. Number 11, I establish mutual accountability levels. I'm just as accountable as my staff. Management team performance standards are basically that every management team member has to have them, just like staff. We can't be treated separately. And then lastly, I groom future leaders. Do I really provide an arena for my staff to practice decision-making and leadership skills? It's critical. And to do that, I've got another tool, and again, you're welcome to have this one. This is a Word document, but basically this document does the same kind of thing, 1 to 5. And it asks each of those indicators on an A1, A2, A3, and you can rate yourself 1 to 5 on each of those indicators and total your score and see what change in score you have over a period of time. You can also choose yourself. You can choose a supervisor or other staff, a mentor that you might have. And we really encourage mentors. I typically do that if there's someone on your team that you really respect and like and appreciate their style of management or leadership, ask if they will mentor you. And basically that means set up a mentoring schedule, meet periodically and talk. Technically and hopefully that would be your supervisor. And hopefully that would work as a supervisor role. And lastly, the leadership coaching styles. They're basically these styles that I have observed and that you'll see in the literature. One is an authoritarian style. It's basically dictums without any basis. Do what I say or you're out of here. That is not a style that I would encourage anyone to have. What happens if you have an authoritarian leader is people with creative and people who really want to grow and learn will leave the organization because they can never make decisions or branch out or experience any kind of growth without the authoritarian leader saying yes or no. And typically you'll see staff leave over time. A default leader is real important to understand. If I do not make a decision, I have defaulted my role. If my staff are saying, what should I do? And I say, well, let me get back with you in a week or two. And those staff are dependent today on seeing a client in an hour, and I'm telling them to wait a week or two till I can decide. That is default leadership. Basically, I don't decide, so the staff go back and do whatever they can do because they have to. They're faced with a decision. So I can be a default leader. Typically, we see a lot of default leadership around performance standards for staff. Well, you know, I know you didn't make it, but, you know, okay, try harder. The other one is knee-jerk, kind of a knee-jerk reaction. You know, basically make decisions without taking anything into account around the long-term needs. Just do it, do what I say. One staff member said she attended my training and said, I'm just going to go back and fire everybody. I said, no. That is not what I'm saying. I'm saying go back and coach everybody. Go back and mentor everybody. I'm not asking you to knee-jerk this thing. I'm asking you to grow with them if that's what you need. Apologetic. I am so sorry, Bill, that I have to ask you to do your job, but the team has approved new performance standards, and I'm going to have to ask you to do your job. I'm so sorry. I don't know. You're so good with our clients, but I am so sorry. Please forgive me. Now, all that does is is no decision making, by the way, and it elongates the decision making process because basically you're negotiating. But more importantly, you're giving the impression to the staff that he or she works for an unfair and equitable organization. Assertive, I use data, I use information, I have meetings, we do pilot programs, and we make a decision. Assertive leadership. And lastly, inconsistent. That's where we call walking on eggshells. That's where staff walk up and say, is Billy in today, or is she doing, is Billy or Sue doing well today, or should I come back tomorrow and talk to them about this? Because we're so inconsistent emotionally with our team that they don't know if it's a good or a bad day to talk with us. These kinds of decisions, these kinds of styles are very important because one of these styles is the most detrimental to the organization that employs you. And one of these styles is most detrimental to you personally, the manager or leader. And typically, the apologetic leadership style is most detrimental to your organization because you're saying our organization is unfair. Sorry you have to work here, and I'm sorry I have to make you do your job. Please forgive me. Or inconsistent, they don't know if you're going to be angry, happy, sad, glad. You told Bill to do it yesterday, yes. Today, Sue gets a no. Inconsistent, your staff can't trust you, and they typically start working around you. Again, we have another tool. It's called Leadership Style Assessment, and here you can identify yourself, again, which ones of these are in your authoritarian leadership. Are you around staff performance? Is that what you do? Or if you look at default leadership, is it around staff performance? Is that what you do? Reactive knee-jerk, apologetic, is it around staff performance? You apologize to staff. Staff behaviors, you apologize for them not behaving well. Staff aptitude and attitudes. So all of these things come together to give you a complete picture of kind of where you are and where you might need to be as a leader. This curriculum is normally 2 days. So obviously we've covered as many as we can today. I hope very genuinely that this information has been critically important or helpful to you and will be helpful. If you would like to have my email address is there. If you would like to have any of these tools, just email me. I'll be glad to send them to you. If you have questions, if you will raise your hand, I will, and Alva, I'm going to, you've got a question, so I'm going to unmute you. I think I'm going to unmute you. Jody, if you're on board, if you could go back in, I cannot seemingly unmute. If you will raise your hand, and again, if you have your hand raised, I'll try to reach you. And that's in the panel.
Unmuted.
Alva was just asking if this recording was going to be shared, and yes, it'll be on the MTM website once we get it uploaded.
Okay, and it looks like Charles has asked, will there be a certificate of attendance offered for this wonderful, informative webinar? Please, for those of us who have to justify the time to our employers, thank you for your response. And Charles, we do not offer certificates. Again, this is a just a complimentary webinar. We do not have the structure set up to do that, but I appreciate your request. Hope it has been helpful, and thank you for your feedback. Adrienne, low turnover at executive level seems to allow some of these challenges to drag on and on. this is great highlight on the differences. And Adrienne, you're correct. It does seem to drag on. I think that's what I meant by taking some of these tools and just sitting down with your management team and say, let's assess ourselves. Let's be honest with ourselves. Let's be candid, I call it. Let's be candid with ourselves and see where we are. If you take that change assessment, you know, do we really change? Do we really have a change system here, or do we really change timely? Do we rarely retreat, or do we actually retreat every time we change? And remember that denial, negotiation, anger, that 1, 2, 3, as soon as we go 1, 2, 3, 1, 2, 3 and back off, then basically the staff learn that they won't have to change. So I would encourage you to sit down with the management team and just say, let's use some of these tools. Will these slides and recording be shared? Yes, they will. They will be sent to you, and excuse me, they will be on our website, I believe, Jody, and they will be available to you, the slide set in PDF form, and the recording of this session. And so that's another question I've had. The answer is yes, same question. Yes, we have lines sometimes outside of the office. Yeah, and that's important, Julie. That's what I learned, is that it was like there was a constant crisis, and what I had to understand is that a leader becomes proactive, not reactive. A supervisor role reacts. And so my staff was basically accustomed to reacting, meaning they had never had a proactive manager to sit down and look at data and say, here's a challenge, how are we going to solve this before it becomes a crisis? We always did it retrospectively. Oh, we got a crisis. Oh, we got a crisis. And so every day was like this, take a ticket number. I felt like Baskin Robbins in a way. You say, take a ticket number and wait your turn. I could not, that pressure, that constant, never-ending crisis wore me out. After about 2 weeks, I was exhausted. And it was such a different work environment. And if you're working in that work environment, it's very important that you try to become proactive using data. Julie, is the other one, is there any type of assessments to help us determine where we are? I think where we are in this process. Again, we have that change management assessment, but also those individual assessments. If you can get your managers, again, your fellow managers and your team members to fill out the assessment for themselves and say, where are we all individually on this? I also have some assessments that we use, basically that have been used for groups that I'll be glad to share with you. Just email me, that basically allow you to see where your management team is. And I've done that in the past as well. While that was so unprofessional, this manager to give the response, I'm not quite sure what that meant, but I logged in a few minutes late. Was the PDF sent out? No, it will be sent to you, Elizabeth. Are we going to get a copy? Yes. Yes, we have a lot of questions about that. What is the book that you are referring to? The book I'm referring to is, and I'll pull it up here, is this book, and let me get it back up. It's the last book I wrote, my 4th book, and it's called Skills, and let me pull that in here. Leadership Skills to Support a High-Functioning Team. You should be able to see that on the screen. Do you see that, Jody?
Yes.
Okay. And also you can see on the left, you can go to the MTM Services website.org/books, and you can get more information. It links you right into the National Council, who is basically the publisher and seller of the book. That's the book I'm referring to in this particular session today.
David, it looks like Jeanette has her hand raised.
Okay.
You got to scroll down a little bit, but it looks like she raised her hand.
Let's see, Jeanette. Here we go. I've got Brenda with her hand raised.
Okay.
So I'm going to go to Brenda first.
Perfect.
Brenda, can you hear me? Brenda Watkins, do you have your phone muted or your line muted? Okay. Let me go on down. Candace, I'm going to try to unmute you. Candace, can you unmute your, there we go. Do you have a question, Candace? Candace Watch, do you hear me? Okay. Caesar, do you have a question? Caesar Acosta?
Yes. Yes, can you hear me?
Yes, I can.
Okay, great. So one of the questions I had is, what do you think about other types of leadership styles like autocratic, bureaucratic, laissez-faire, charismatic, along those lines?
Well, again, I think the one that I've settled on, and I've looked at so many over the years, Caesar, and studied so much. I mean, you can buy, I don't know how many hundreds of leadership skills books there are out there. You know, when I wrote my book, it was like I did some research on how many were out there, and it was just ridiculous. But I've tried to look at mutual respect management, and mutual respect management includes the characteristics I've shown you today. That I respect the staff that I work with, and I want them to respect me. And that would be that I'm going to do everything in my power to help them achieve and grow here. And I want them to help me create an environment so that I can grow and change here. But the mutual respect manager, to me, takes care of all the charismatic and all the others. If I'm respecting someone, there tends to be really good growth of a team. And there seems to be a lot better trust within the team. I think any of the other styles like authoritarian, some of them, you destroy trust. People, when you ask them to really step out and risk, they don't trust that they're going to be okay. I hope that answers Caesar.
Yeah, thank you very much.
You're very welcome. Thank you. And let's see, I'm going on down. Denise Stewart, can you here's your question. I would appreciate a copy of the assessment tools. Yes, and again, Denise, if you'll just, again, email me, I'll be glad to send those to you and be glad to send those to you. And thank you for the great information. Appreciate that comment, Denise. Appreciate it. I'm going to go on down now. Okay, Jeanette, I'm going to recognize you. And again, if you could ask your question and unmute. Jeanette Suarez.
Hi, it was answered. Thank you.
It's been answered?
Well, someone had asked the same question I was going to ask you, so it was answered. Thank you.
Okay. Well, has it been helpful today?
Very, very helpful. And made me realize a lot of things that I was doing that some were correctly done and some weren't. So that was an open mind.
Fantastic. And again, if you want these assessments, I'm going to put my last slide up. Just email me and tell me what you want. And these slides will be posted. Jody, will they be posted tomorrow on the website?
Yeah, probably the slides and the recording will go up tomorrow. It takes a little bit to download the recording once it's completed. So I would say you guys can go look for it tomorrow.
Okay.
And what's the website?
It'll be on the MTM Services website.
MTMservices.org. You can see it right down here.
Okay. All right.
Right
Thank
down
you.
here at the bottom of that page. Okay, I'm going through. Wonderful presentation. Thank you so much for these comments. I really appreciate it because we don't get a chance to commune with you because we're not together. Thank you so much. Great. Thank you. No question, but this has been great. Thank you. Do we need to provide our attendance in the question bar? And the answer is no, since there is no certification or attendance requirements. It's just a complimentary effort to try to be of assistance. Can we get a copy of a PowerPoint? Yes, you can. And the assessment tools, again, Tricia, if you will send me the email of what tools you want, I'll be glad to do it. Provided I didn't catch it, can we get copies of the leadership assessments? Yes, you can, and that's Robin. Just email me, and I'll pull that up right now. Let me get back to that slide so you can get to that email address. It's basically my contact information, and I'm going to pull that up right now. But you can see my email address on the bottom, and there's a website for MTM Services if you want to go on for the slides. I come for profit, and this will help me to know how operational leadership styles from middle management. And again, from middle management. And again, I think the key thing as a middle manager, if you are there now, take the characteristics and qualities that you have that I've given you and start exemplifying those. For instance, when I started with this multinational company, I didn't start as president, certainly didn't start as CEO. I started basically as just a clerk. But what I started to do was to look for opportunities to look at what could help the organization. You know, we have organizational structure to assist clients. And if our job is constantly looking at what can we do to better assist clients, to do it more effectively, to do it more efficiently, to help staff unload some of the overwhelmed feeling they have, if you can start looking in those areas, even if you're in a middle manager, as you said, it doesn't matter. If you can start identifying them, then ask, just write up a recommendation. Can we try this? Can we pilot this difference? That's what I started doing. And so the chairman of the board started to recognize that I was coming up with ideas to help the organization to be efficient, to be effective, to be customer service friendly. And after a while, he started to ask me to sit in on the management team meetings. You know, fantastic. So wherever you are, you can start using and developing your skill sets. Remember, this is not, Lisa, this is not an event of becoming a leader. It's a process. And as I said in my book, it's 52 years in my process. I'm not saying it should take you that long. I'm saying that every year I gain some more skills. And so basically, how do you change organizational leadership styles from middle manager is you exemplify, which is your question, you exemplify the leadership style that you think could be helpful and see if they pick up on that. You see, attitude, remember, attitude is the spark. You know, if I've got a staff who's got a very positive attitude, it will influence others. It really will. So look at those attitude attributes. I find a supervisor and I'm supervised and it's built some bad habits. Again, Lisa, it sounds like, again, encourage you to look at some supervision plans. Michael Flora will be presenting on supervision, and that will be, I think, in July, late July. And so look at his scheduled webinars because he will give you some very good tools on supervision plans. And Caesar, you posted yours. I've answered yours. Leslie, any info direction in the presentation that you think should change based on the high level of turnover and workforce recruiting challenges at this time? I would say, Leslie, that's a, yes.
Oh.
Yes, uh-huh. Does somebody have a question?
Oh, there again?
I'm sorry, does somebody have? We are in a very difficult time in staff turnover. I think the key thing is that we cannot back off what our organization needs for the clients we serve. Again, this is back to client service. If we can't serve the clients, then we have to have certain performance standards and requirements. If staff cannot perform those, then our job is to coach them up and try to meet it. But I'm concerned today, what I'm hearing is there's a lot of turnover, and if I ask my staff to do anything more or to improve their performance or turn in their documentation, they will leave. And I'm thinking, well, what is the situation you're in now? It sounds like you're in a very chaotic, you know, crisis process situation. Is that healthy for anyone? So I would encourage you to ease into it, but not back off from it, if that makes sense. Amanda, if you would like the assessment forms you shared, just simply email me at the address on the screen, Amanda, and I'll send those to you. Jeanette, can you provide webinar website? And that's going to be right down here at the very bottom. And let's see, Jeanette, question answered, thank you. How do you manage employees? This is Brenda. How do you manage employees getting angry while also being judged by employees needing to give positive feedback on engagement surveys? Again, remember what I call the process of change. It's almost a grieving process. Again, denial, negotiation, anger, dropout, acceptance of the need. My job, if staff are angry and are getting angry because of the change or the increased performance requirements, my job is to get them to accept the need to change as quickly as I can. How do I do that? I give them data to show where we are and where we need to go, where they are and what change they've had and what they've been able to accomplish. I celebrate every incremental accomplishment and I let them see where we are. The worst thing that we can do for a staff who feel overwhelmed by the change and come to that denial, negotiation, anger stage and dropout stage is that, you know, I can't just say we're trying and everybody's trying hard. I need to be able to break it down and let the staff know where they are and how we're doing as a program. Example, one of the things I did is to publish information and performance information for my teams. And again, that was, oh, you can't do that. But what I was trying to show is that Bill or Sue on the team were making a new standard. And so what I asked them to do in our team meeting of that team is, Bill or Sue, can you tell us how you have made this new standard? What is your operational process or your practice process? How have you reduced the no-shows? How have you completed your documentation? I wanted them to mentor as a staff to other staff. I needed to get out of the idea that this is impossible. What you're asking us to do, David, is impossible. I had to get out of that idea by showing them that some of the staff right here in River City, right here on the same floor of the same building, are actually doing it. And I did that by, again, asking them to share a case study. Candace, I've been answered, thank you. Viv, what do you advise a line worker who would like to be a leader? I would encourage you to take these tools, Viv, and really practice them. In other words, understand what the characteristics of a leader are and start to practice them. In other words, as I said, this is not an event. It takes practice. It takes sometimes years. And as you evolve and become more comfortable with decision making, or as you evolve and become more comfortable in setting boundaries, as you evolve and become more comfortable with the qualities of leadership, they will show. I mean, it will show to the people around you. Steve, what are some ways to assess a person's attitude without being judgmental? And what are some of the indicators for good and bad attitude? And Steve, I don't have the time today, but we have staff performance, behavior, aptitude, and attitude indicators. And I'll be glad if you, Steve, if you'll send me an email, I'll send you the staff indicators. You're right, you can't be confrontive and you can't be judgmental, but you can look at staff indicators around, are they cooperative? Are they, we can do this, or it's always, no, it won't work. You don't understand, I'm different, poor me, woe is me. Those indicators, again, are some that you have to look for, and then you start supervising around them and documenting them in your supervision notes. And you introduce not 5 of them at one time, but 1 or 2 at a time. You try to help the person. The other thing I did, Steve, in my meetings, if I had staff who exhibited great attitude indicators, I would recognize them for that and ask them to share a case study on how they handled something that I thought another staff could benefit from, but I never identified the staff who had the poor attitude. I just identified the positive. So I stressed the positive, Steve, and let the positive set examples, hoping that those who didn't have the positive attitude in those indicator areas would catch on. And if they didn't, then I used it in supervision. And I would say something like, Steve, remember when Bill shared what he did? I was comparing that kind of to what happened to you the other day. How do you think you could have handled that differently? And I would use that other information to try to, not for me not to have to say, Steve, I think your attitude's horrible, because that's not going to work. You drive people away. The book isn't available on Amazon. And again, it is, Natalie, it is at the National Council. You can come to our website and just go to resources and books, and you can click in and buy it through the National Council. Can we wait until the request resources when we review the PowerPoint? Yes, you can, Tanya. You can request them at any time. Do you have any tips for young managers who are supervising employees that are older than them? Yes, earning respect. And the answer is, Katrina, you're going to have to do it one day at a time. I think I started at 22 years old in a company where most of the leaders of the company were my parents' age or older. And I certainly was the new kid on the block. But I had to show them that I was willing to show up, I was willing to make tough decisions, and I would hang in there and carry out whatever I was assigned to do with the best possibility of effort that I could give it. And you earn that respect. You can't demand it. But it just takes one day at a time. Just keep doing what you do every day. And one day somebody will ask you, hey, you want to sit in on this meeting? What do you think? They'll start valuing your opinion. Carol, you asked, great presentation, thank you. Does your book address on manager managing multiple offices in multiple counties? Yes, it does. And again, that's going to be a challenge, because you have to have data. You have to have information from those other operations so you're not operating in the blind. And then, Viv, thank you for your excellent presentation. I think that's all that we had here. Again, we are out of time, and I hope it has been helpful to you. My best wishes, and again, I'll go back up to The contact information is here. You can go on our website to look at the next webinar, and that will be Dr. Westhead. Thank you again. Best wishes to you, and hope everyone has a great summer. Nice to work with you today.